Well, class is back in session, and unfortunately so is COVID. As students fill hallways and classrooms this fall, health officials are keeping a close eye on rising cases right now.
So to tell us more about how to stay safe in school, we are joined by Dr. Ulysses, who is the Chief Epidemiologist and System Director of Infectious Disease at Hartford Healthcare. Thank you so much, Dr. Wu, for being here.
Thank you for having me again.
Doctor, I know we spoke to you endlessly when we were talking about the pandemic, and now COVID is still a thing. So what are the current trends now as kids are heading back to school in the fall?
Well, as we have seen every single year, and thankfully not to the extent that we've seen in previous years, we are actually seeing an increase in COVID cases across the country as well as within our state. Like I said, not quite the spike that we've seen, but we always see this late summer surge that starts happening. A lot of it is due to variants. It's kind of end of the year gatherings. It is a very social disease, so that's why we see these spikes.
And what kind of symptoms should parents and teachers be on the lookout for?
The same exact symptoms that they should have looked out for not just the previous COVID variants, but as well as any other respiratory disease. So we've kind of lumped them all together along with the other respiratory viruses such as rhinovirus, RSV is going to be coming, influenza, parainfluenza, these are all fancy names, but they all tend to have similar symptoms. And so the problem is there's no one single symptom that says, oh, this is COVID. And so it's always good to see a healthcare practitioner to see if you can get a diagnosis, because some of these are actually treatable.
Yeah. So what measures are schools implementing to prevent the spread of COVID? I know we don't have those restrictions anymore, but what should we be doing?
Well, I wish I could tell you what the schools are individually doing. So really, the onus falls actually a lot on the child and, well, more so the parents of the children as well. And so that actually has not changed at all that much. We are still recommending, if you are sick, try not to get somebody else sick.
Yeah.
So don't go get somebody else sick, or you may want to have to keep your child at home, which I know is difficult for people. Vaccines are out there. It will help prevent the spread, and not just for the children, but as a halo effect, the family members around. Masking does actually work to a certain extent, and so that can be suggested as well. And then we say things like hand washing in addition to all of the above measures.
Yeah, that's the first thing I make my kids do when they come home from school. Right to the sink, wash your hands. Thank you so much, Dr. Wu.
Thank you, doctor.
Thank you for having me.
And for more information, you can go to hartfordhealthcare.org/COVID. Yes, we got to remember, still wash those hands.
Of course, actually.